Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome back to the Low Carb MD podcast. Troy, I know we say this every week, but we have a great one this week. I'm excited. Good to see you too.
Yeah, absolutely. Good to see you, and good to see everybody who's sort of joining in live, and good to see people who are joining in with us from the Toward Health app and Brian's practice and my practice. We're super excited to be here. We have an amazing guest, and I think this is a topic that we're going to be talking about that hasn't been talked about. Two important topics, I think. We'll have a chance maybe to discuss ketogenic therapies in the pediatric population and also the perimenopause population. So I'm really looking forward to that. And we have somebody who is literally the OG, somebody who has been, practicing ketogenic, or at least talking about ketogenic lifestyles for 3 decades. Her name is Beth Zupec-Kania, and I'm so happy that she's joining us. She is a dietitian. She's a world-renowned expert, an RDN. She's a speaker. We've met, I believe, at a conference in the past. And she's a very active member of the International Ketogenic Society. And she's been working with the Charlie Foundation, who everybody knows helps children with pediatric seizure disorder. So we are just super excited to have Beth join us. And Beth, it's an honor, and I'm so glad you did this. I know you're stepping out of your bubble a little bit, so I'm super excited that you're doing this and super grateful.
Well, thank you. It's really an honor to be here. I was a little nervous because I thought, oh my God, this guy's huge. And but I'm really happy to be here.
We're glad to have you. Tell us your story. Like, how did you get into this line of work, or where you end up at the Charlie Foundation?
So I've been working with keto for over 30 years, and it really started because nobody on staff at the Children's Hospital I was at for 20 years wanted to do it. So I thought, oh my gosh, this sounds really interesting and challenging. And so I decided to go for it, and I really didn't have much knowledge from my training. So I connected with people that were knowledgeable, and that was the staff at Johns Hopkins and the Charlie Foundation. And they saw how hungry I was to learn, that eventually I started consulting for the Charlie Foundation, and I got very comfortable with the staff at Johns Hopkins, and I've written several papers with them, and namely consensus guidelines on how to use a ketogenic therapy for children, and another paper soon after for adults. So that was my training grounds, working with epilepsy, and then consulting for the Charlie Foundation to help bridge the gap between what the professionals need to know and what the public was craving to know. And the public needed to know how to implement this, and food and recipes and connecting people with other people. So it really was, for me, a great way to merge all of my talents. I'm an artist, I'm a musician, I like being creative. And I also am a geek with science. And so I just love what I do. And I'm in my late 60s, and I'm not planning on retiring for several years, because this is so fascinating to me to see it expand out of neurology, out of epilepsy, and expand into eating disorders, psychiatric disorders of other types, other neurological disorders, certain cancers. And I've worked with many of these patients privately and realized it's about the same efficacy as it is for epilepsy. About 60% of people, no matter what they have significant improvement with a planned ketogenic therapy. So that's what I do in a nutshell.
You know, I want to come back because there was a offline, we were chatting just to get to know each other a little bit. And, you know, we were talking about our frustrations with the current sort of dietetics community and the current medical community. And I want to go back, you know, because you've been doing this for decades. I want, you know, I think you've probably experienced and you've probably, you know, shoveled this deep down inside all the frustrations you've had over the years with medical providers, with maybe, you know, doctors, neurologists. Like, can you walk me through what you faced as a dietitian in this small space, which is now becoming bigger and mainstream, but wasn't always? I'd like to get a feel of what this was like in 1990, in 2000, 2010, you know, what was it like to be, you know, promoting a taboo diet?
Yes, so that's such a good question, and I see so many parallels with these other applications of keto to what I went through with epilepsy and how there was so much pushback because there was until 19, let's see, I have to think back on the first year that the randomized controlled trials, 1992 maybe, the first randomized controlled trial in epilepsy, where everyone sort of just breathed a sigh of relief, like finally we have this to go to for hospital administration, for pediatricians, whoever needed to know about it, first for pediatric epilepsy and a few years later for adults. But it was years of seeing, in fact, this is the reason I left hospital work. I saw how effective this diet was and how so many kids just became kids, you know, going from being sedated and having many seizures to being able to develop and hit their milestones. I saw that regularly in the majority of patients. To see that, but then to see that our administration wasn't really supporting my role. They were limiting my hours. They weren't promoting it as a service. And although the neurologists were wonderful and, you know, welcomed me into their clinic, they as well limited my time. They wanted me in and out in 15 minutes because all they had was 15 minutes for follow-ups. So there were so many limitations, and it frustrated me so much that I left the hospital thinking I can do so much more than this on my own. So I went out on my own into private practice, and I started working with people privately around the world. And that's where I, you know, branched out beyond epilepsy and started working with other conditions. And I'm a consultant in several studies for mental health, one in children, and just finished up for a large study at UCSF for adults. And, you know, the therapy is expanding beyond my wildest dreams, but there are so many core elements that are similar along all of these applications. And part of it is this pushback that we're getting from the traditional paradigm of medicine. And, you know, we're going to break through that, but slowly, this grassroots effort to bring people in and train them and get people like you, support people like you who are out there talking to thousands and thousands of people that you have in your audience. This is how we have to do it, because it's not coming top down, it's down up, right? This is the grassroots effort that we're raising.
Yeah, I believe that also. And, you know, when you say it's one of those darn things, you go, we have to be patient. 30 years you've been doing this, 30 years that you've seen people do better. 30 years later, and it's still kind of like, yeah, you could. And I'm curious, Beth, when you first started, were you a skeptic too, going, how can diet really affect something as traumatic as seizure disorder? Because for me, when I first heard about, I'm like, ketogenic diet, what the heck is that? I had no idea. And I started looking into it and going, wow. And then, like what you're saying, it's so refreshing to hear again. But when you say all these other conditions, 60% of the people can show improvement, you think, because Tro and I would feel funny because I'm like, we were seeing people's mood get better, depression, anxiety, bipolar, alcohol abuse, pornography abuse, you name it. We saw people getting better, and Tro mentioned it publicly, and then we got ridiculed by doctors for a week, and saying our license should be taken by even talking about this. So I'm just curious, like all those things, like how did you walk into this realm, and when did you first say, man, there's power to this?
Yeah, I can remember it was when I got to my 15th patient. So I had my 15th patient, and every single one of these patients had some degree of improvement in seizure control. But it was, I kept thinking, this could still be luck. This is early. They're only 3 months in, or they're only 4 months in. But after this 15th patient, I sat back and thought, this is incredible. And why aren't the neurologists like clamoring to offer this to all their patients? They really waited till the patients requested it. Like it was the educated parents who were on the internet or finding out through the hospital that we had this program. They were not offering it to all patients. So, here again, it was this very limited use. And still today, unfortunately, even though keto's been known for over 100 years for adults and kids with epilepsy, that's when the Mayo Clinic first reported on it, it's still highly underutilized. Not everybody has a program, not every hospital. And that's part of what I do. I used to travel and train hospitals, and then COVID hit, and now I do virtual training for dietitians and other health professionals. And, that's how I have felt the best way to make a difference is to train these professionals not to be afraid of it, and that it can be used alongside of their traditional treatment, but that it needs to be offered to everybody that can benefit from it.
I want to step back a little bit, because I think, knowing a little bit about the history of how, maybe you'd be the best person to sort of even describe this, but describing the evolution of the ketogenic diet in the neurologic space, because I'd imagine 5 decades ago it was a strict, very high fat, 90% fat, 80% fat, 5-to-1 ketogenic diet. And I know the literature has expanded over the years and still expanding, modified Atkins and just, frankly, just low carb with not much other consideration. And with fairly good efficacy. So meaning, like, for the listener out there, the thought 5 decades ago may have been that there was only one way of doing it, and now it's sort of broadened, even in this sort of critical condition of epilepsy where the stakes are high, right? Let's be honest, the stakes are high. Having a seizure is a potentially life-ending event, right? And a very serious event. So can you talk a little bit about the history of the ketogenic diet over the decades in your experience?
Yeah, so the evolution of the ketogenic diet has been significant. I started working with the very classic ketogenic diet, which was 90% fat. And there were issues with that. We had kids getting acidotic. We had kids not growing well. We had kids not tolerating the diet. What we learn over time is that we could still get the same improvement in seizure control if we loosened up on the high ratio that the Mayo Clinic reported. So the initial classic ketogenic diet is based on this 4-to-1 ratio of fat in grams to non-fat protein plus carb. So move ahead all these years later, we're using quite liberal ketogenic diets where people are in a fairly low state of ketosis, and they can eat what their culture eats with modification. And we can make it carnivore, we can make it vegetarian, we can modify it for gluten-free, which actually the classic ketogenic diet was gluten-free because they just used whole foods. They did not use grains at all. So it can have all these variations. and still be effective. And low ketosis sometimes works beautifully. We still, for pediatric epilepsy and for adults for that matter, but kids tend to have higher ketones, yet we don't know what a target ketone level is for epilepsy. It's still unknown. So what we do is we just try to personalize the diet and see how seizure control goes. And if there's some improvement in seizure control and the parents are willing, or the adult is willing to tighten up and reduce their carb and increase their fat, we try that for a period of time. And keep in mind that for epilepsy, a strict version of a ketogenic diet where you're really cautious might be temporary. It might just be a year or 2 years. And for most children, they come off after 2 or 3 years. My adult patients with epilepsy, they're usually pretty strict for a year, and then they start to taper off a little bit and challenge, the degree of ketosis. And many of them have the same seizure control that they have achieved. So there is flexibility within a person's ketogenic diet to adjust it over time. And once people understand that, they're not so afraid of it. Both the patient and the nutritionist, you just say, listen, you pick a starting place that you can agree on, and then you work with that over time, and you can adjust it to affect higher ketones or lower ketones, whatever works for that person. So yes, the evolution of keto has been so significant. This is why I never thought that I could be on a ketogenic diet, because I was using these really high ratios in children for so many years. And then when I realized I need to put myself on a ketogenic therapy for my insulin resistance, I became a much better practitioner to my patients, because then I had to figure out how to eat in this manner as well.
I got to chime in here because I want to talk about this, especially your own evolution. I want to hear, how you took your knowledge and then applied it to yourself. But I want to stick a little bit with kids, if we don't mind, because, you have a wealth of information. I think, Brian and I are internal medicine docs, and I know Brian faces the same exact issue I face, which is, we're working with families, often a husband or a wife, and we're trying to help them, make this home a safe space when it comes to food that is gluten-free, sugar-free, processed carb-free. And so I'd imagine it's even harder when you're dealing with just the children, right? You've probably had to convert whole households. And we hear it all the time. We hear kids, parents saying this. Brian, how many times have you heard somebody say this? Which is, I just can't help it. I'm eating what my kids eat and I'm gaining weight. And we're like, well, maybe you should fix what your kids are eating, right? Well, we should fix what our kids are eating. So how do we fix what the kids are eating? Beth, can you talk to us about how because you've done this your entire career and you educate on it, like how do you, there's a mom and dad out there struggling right now because their kids are eating, who knows what, the Cheetos without the red dye anymore, and they're having the Cheerios without the, still with the glyphosate, but without the, the additives. So how do you do this for the kids? I'd love to hear all your tips and tricks.
Yeah, so I think what you're asking is, how does a family adopt a low carb or keto therapy given the high processed foods culture that we live in today? Is that what you're asking me?
Yeah. How do you, it's dealing with, like the kids are exposed to school foods. Mm-hmm. They're exposed to all sorts of junk at birthday parties, at sports events. vending machines in schools. I mean, absolutely. Like it's more than a junk food environment. It's also our social constructs, which I'm sure you've dealt with. You know, what we feed each other at birthday parties, what we feed each other at family events and holidays. I mean, it is impossible for a kid in our world today not to end up with fatty liver, obesity, and prediabetes, which is, you know, a shame. So,
Yeah.
but I'm certain you've had to fix their environments throughout your career. I'm certain of it because I know what it takes. You know, so
Yeah.
so if you can help me understand how you did that, because there's a parent out there who's going to be listening to this, you know, and they're gonna benefit from everything you're about to just say. So so if you're that parent, listen up right now.
Yes. So two things I start off with when I work with families, and one of them is I give them a handout I created for the Charlie Foundation, which they can get through the Charlie Foundation, on what eating a whole food, gluten-free diet looks like. It's a very picturesque kind of handout. And it's not ketogenic, but it's just teaching them what whole real food is and how they can start selecting mostly from that list. And then I say, you know, after you've done this for a while, if you want to move on to keto, I'm going to help you with that. But this is your step one. The other discussion I like to have with them is one about the whole issue that you just brought up, like how do you change a culture in someone's family on food when they are going to have those kids that they love go out into the world and be exposed to all the stuff that you don't want them to eat. So I talk about this like religion, like this is like changing your religion. It is such a big deal, and you have to get everybody in the household on board with this. Teachers, whatever environment that kid is, they need to have something in writing. And I've written these letters and passed them out so people can put their name and their kid's name and use it as a template. But this is so important that this medical treatment, which is recognized as effective for XYZ, epilepsy, bipolar disorder, migraine headache, whatever, but it has to be that kind of effort when everybody is on board. And there's going to be mistakes. I tell people, like, there's going to be some point where your kid's going to cheat or someone slips them something or they trade food with somebody. Those things are going to happen. Just understand that, you know, those aren't failures. That's just life. But how to learn from that and get back on board. And, you know, speaking specifically for epilepsy, there's so much motivation for these kids to do well on a ketogenic diet because it means their brain can heal from something that can be lifelong and devastating. And once they understand that, those words, healing of the brain, and neurologists aren't comfortable saying that. They're comfortable recommending medications that control seizures, which is a symptom, but they're not comfortable talking about being able to heal your brain. So I think once parents understand that it just empowers them, like, oh my gosh, we have control over our child's future, and not just their health, but everything that goes along with being able to thrive, live, you know, function in society. So this is one of the reasons I was very compelled to stick with just keto therapy as my career path because families are willing to do that. And it is amazing to me. And half the families I work with were on financial support of, you know, state or federal support. So I'm not just talking about highly educated people. I find people motivated across the board, no matter their financial background, who are willing to do this. I've had single moms. I've had people that have only had a high school education do a ketogenic therapy well because they want their kid to thrive and live.
I think that's such an important point. It's so frustrating. Tro, remember the Reynolds family we interviewed from the UK? Their son was having seizure after seizure, 12 to 15 a day, every single day, soiling his pants, and they're changing his diapers. He can't stand up. He's miserable, non-interactive at school. And someone tells him about a ketogenic diet for seizure disorder. And then they do it and it works. And he went to the neurologist and said, how come you never told us about this? And the neurologist said, well, it's so complicated to do and it's so challenging. So people just can't do it. So I don't tell anyone about it. And you think, now the kid's not having any seizures. He's like the class president. He's playing soccer. He's doing sports. You go, oh my gosh. Like, how could anyone, if you know there's something that's beneficial, how could you withhold that from people? At least give them the option of saying whether it's too difficult or not.
Yeah.
And that was his point. He goes, how difficult is it changing diapers 12 times a day, on a 12-year-old kid? It's ridiculous.
This is exactly what happens over and over and over again. And at the Charlie Foundation, we hear this complaint all the time. My doctor didn't tell me, my doctor didn't tell me. And the doctor knows about keto. They know. They go to meetings, they see their journals, they know that exists. And in their excuses, it's too hard, or I don't have a dietitian. But we don't see them going out to the administration and say, let's figure out a way to hire a dietitian or find me somebody that can do this part-time or virtually until we can get a program going. So yeah, that is the unfortunate situation. And it's not the doctors say, it's people should know when there are randomized controlled trials and 2 Cochrane reports saying keto works for epilepsy, no matter what age, you need to provide it. And I would go as far as saying it's criminal not to at least offer it or to explain that this is a therapy that's available. We don't have it here, but you can go to this hospital. The Charlie Foundation has a directory of hospitals globally, and we're actually updating it right now. And most of it's epilepsy, but we're adding psychiatry and other conditions, cancer, et cetera, where we know that there's programs.
Wow. Like going through chemo, Troy, just one thing on it, because I just have to ask this question because I don't want to get through the podcast and not ask. When you said they can go on a ketogenic diet for 2 years and come off it, I've never heard that in my life before. Have you heard that, Troy?
Yeah, we've had
that's amazing.
We had a guest who actually proved.
Oh, I was probably not listening.
Seizure. Can you hear me?
Yeah, I was probably not listening that day because I've never heard that before. I've heard someone say that for them that they got better, but I've never heard it as a general that someone that we can generally do that. And I was like, wow, that's pretty amazing.
When we say come off keto, I mean, I would be very clear about what you're saying. I doubt these people are bringing sugar and processed carbs back to their lives, right?
Yeah, they're not as strict. They're liberalized in their diet, not going to the standard American diet. I would assume that's what you're saying, Beth.
Yeah, like a modified Atkins, basically not necessarily 90% fat, just low in carbohydrates and gluten.
Yes, although I can tell you there's people that don't do that because years ago, I've been doing this again for 30 years. Years ago, we had, okay, you're off, everything should be fine. And 80% of kids who were seizure free, it's been reported, maintain their seizure freedom. About 20% have reoccurrence of seizures. And those are the ones that we say, okay, let's see what we can do. We want to go back to like the last step of your weaning off the diet phase where you were eating maybe 60% fat. You want to go there because this kid was seizure free at that point. Or do you want to try a new medication? So yes, the majority of children can come off the diet after 2 or 3 years, and you wean them gradually to make sure that they're maintaining their seizure control. And I think the same can be true of adults, because we don't know for sure because there aren't published studies on this, but the adults that I've worked with epilepsy or migraine headache and even bipolar disorder are saying, after a couple of years of being fairly strict, they were able to reduce their ratio, come out of ketosis, and maintain, the level of wellness that they did on a stricter keto diet. So that's why I talk about healing. Like there has to be some healing that
Yeah, that's amazing. That's amazing. And my next question on that is, what do you think that, like, in all, like, 30 years of doing this, because I've always in my mind said, okay, why is it that we're seeing these improvements? Is it the ketones? Is it that we're decreasing the toxins going to the brain? Is this have to do with the gut microbiome? And like, is it a combination of all those things, or do we have no clue still?
Yeah, every talk that I've gone to, and I went to the global symposium about a month ago in Paris, the researchers are still saying it's multifactorial, and that's why nobody has come up with a drug to replace the diet. I'll never forget about maybe 20 years ago, a neurologist, a leading neurologist, I won't say his name, said to me, Beth, I'm going to put you out of business, because he was working on a drug to replace the ketogenic diet. And that drug failed in human trials. And, there's a lot of ketone supplements that are out that also were intended to do something similar. And I know those can be helpful for boosting ketones, but they don't replace the ketogenic diet. So, the anti-inflammatory effect is huge. The increase in BDNF, the increase in autophagy. There's so many metabolic effects that we know that are happening at the same time. So, it's been said it's not just ketones. So just taking a ketone supplement is not going to fix things.
I want to propose a dual mechanism. And I hate it when Brian's right. So it pains me to say this. I think when I've looked into...
Sure, I've been telling all my patients, I go, I think Tro's, listen to Tro. They're like, oh, he's coming around. Tro's coming around. So here we go. Let's see, Tro, if my patients are telling me the right information.
I said this even with the propagandist who we had on it, 3 months back. But there was a very interesting mouse study where they took ketogenic mice and they gave it to knockout mice for seizures. They basically gave them intractable, and you're shaking your head, so I know you know the study. And they gave them microbiome from ketogenic mice, and they gave it to the intractable seizure knockouts, and it basically resolved their seizures. And then they wiped them out with antibiotics, and the seizures came back. So I think it's very clear that the microbiome is at least one element of the other thing. I think also the second mechanism, and this is just me hypothesizing, is sugar it lowers the seizure threshold. Sugar must lower the seizure threshold. Like blood sugar fluctuations, I should say, I think lower the seizure threshold. So I think it's a two-hit, if you ask me. And I think the same is true for mental health disorders, by the way.
And this is going to tie into what Beth's going to say, and I'll tell you, Beth, this is exciting for me. I have a guy, he's in his early 60s, had seizure disorder, carnivore diet, seizures got worse. And, we looked at his gut microbiome. He had a lot of leaky gut, and his A1C was high still, even though he was strict carnivore. I said, let's just try fixing your gut. He didn't change his diet one drop. We fixed his gut. He hasn't had a seizure since we fixed it, and his energy and his focus. And he goes, this is unreal. Like, I feel the best I've ever felt. So I think that what Tro's saying is true, because I've been telling him this for 2 years. That's why I agree with him again. But I think this gut microbiome thing, because ketosis does help heal the gut lining too. So maybe these kids have really, and I don't know if this has been looked at in these kids, if they do have a lot of dysbiosis in their gut and gut inflammation, and that's what is contributing to these seizures. Like we're all saying, that increased inflammation, high sugars are going to lower that seizure threshold. And, Chris Palmer saying, oh, I'm treating schizophrenia with the same, and it's the same drugs that we use for seizure disorder, and it was really fascinating. We just had on Ian Campbell, and he was talking about, bipolar being this hyper metabolism in the brain. So are we looking at the same kind of pathophysiology that's going on, and that's why we're seeing the benefit. So that's why I'm so excited about your work, and like you're saying, it's not just one thing, it's maybe this combination that we're seeing a benefit from.
There's a study, it's actually a case report of a teenager who had Crohn's disease and epilepsy and received a fecal stool transplant for his Crohn's disease from a relative. And after that transplant, no more seizures. So I wrote to the doctor recently because I wanted to give them an update. And I said, is the kid still seizure free? Because they reported it like at 5 months or something. And are you doing further research on this? And he wrote back, he said, 1, yes, still seizure free. We're like 4 or 5 years out. And 2, they're studying it in epilepsy. So I don't know. There is some research in epilepsy in kids looking at their microbiome. And if I remember right, with keto, they had a significant increase in akkermansia. So that's, as you probably know, has become a big microbe of interest. But, we know that neurotransmitters are largely made in the gut. So it makes sense, right? If you're not making your neurotransmitters because your gut's sick, it's going to affect your brain and your thinking. And the clarity of mind is what most people report within, a couple of weeks of starting keto. In children, I see it in a couple of days. That's what really made me sit up and be like, whoa, this is powerful. A kid that was like slumped in their wheelchair and now is sitting up and looking around and asking questions in 24 hours of being in ketosis. So it's mind blowing how effective it can be.
Well, and now that you're saying that, it's just, and Troy, I don't know if I've ever shown you this video or if you saw it in one of my talks, but there's a guy named Dave that he advanced dementia, drooling, like you're saying, in the wheelchair, drooling, looking at the ground, no interactions, no nothing. And we have video of him in that state. And then also less than 2 months later, after being on a ketogenic diet, and my friends from Health Code sent Health Code, so I'd like to give them a shout out for that. But they sent Health Code. We got them on Health Code. We got them on a good fat diet. We took them off all the terrible Nestle products that are out there. And within 6 weeks, he's playing catch, bounce, catch, and laughing with his great grandkids. And you go, my goodness, like how many people are staring at nursing home walls that don't have to? And how many kids are having intractable seizures around the world that we can intervene and we're not? And it's devastating.
Yeah. Oh, you're going to get me going here. So I have 2 elderly clients whose family members came to me. This was a few years ago, and they both have let me talk about this because they were such significant cases. So I have a lot of experience working with people with feeding tubes because I've worked with neurologically devastated patients that are having seizures because they're so devastated. And they can't swallow, they have dysphagia. So they have a feeding tube. So it's easy to do any nutritional formulation because it goes through a feeding tube. They don't taste it. There's no refusal. It's like a home run in terms of getting efficacy and consistency. So I had 2 patients with similar backgrounds. They developed dementia. They were in diapers. They basically sat in bed or watched TV all day. And their families were like, this is not acceptable. And both of them came to me and I said, well, there aren't any ketogenic formulas yet. Now there are, but there aren't good ketogenic formulas. There was actually a commercial one that I just didn't like. I said, but if you can blend up food from recipes I give you with enough water so they go through a feeding tube, you can do this. So in both cases, there was such significant improvement. Both of these elderly people were able to get out of their diapers, had like the ability to play games and sing songs. And they both had Alzheimer's disease. So their Alzheimer's disease didn't go away, but they were now functioning with, some recall of long-term memory, singing old songs that they knew and talking about the old days. So it was so incredible in both families. And it was easy because it was feeding tubes, right? So then I thought, oh my gosh, how many people are sitting in nursing homes so sedated from their 60% sugar formulas? This is what the Ensure formula is. It's 60% maltodextrin. That's usually like about over a cup of sugar a day that somebody
Don't forget
is
the
consuming.
cholesterol-free soybean oil. So
Yes, and the polyunsaturated fats that are highly oxidizable. And people are thinking it's just because they're old and they have dementia. Well, my two patients, everyone thought it was their age and their diagnosis, and they had a lot of life left in them.
Well, along those lines, I'm not sure if you're familiar with Melanie Tidman. She's doing work with Parkinson's disease. She has a case report of a 32-year-old on hospice that was near death. And the family said, "What is there anything we can do?" And she said, "You're not going to like this, but you can put a feeding tube and put him on a ketogenic diet and see what happens." The guy went back to work. He went back to work. Poor guy. Sorry, you had to go back to work, but you're not dead. But those kind of things you look at and think, wow, how many times could we, like, how powerful of a tool is this? And people just blow it off because it's not a prescription. If we were a prescription for it, maybe people will take it seriously, but no prescription I give has those kind of effects.
I know it is just incredible how underutilized this is for so many conditions. But man, if I had the ability to go into like a children's home, because there are children nursing homes for kids in the U.S. There's a whole contingency of them, and they connect. I've networked with them and taught them about keto, but again, nobody's really out there clamoring for it, so it's not highly used. But there's endless work that can be done to get this therapy into the hands of people that can benefit from it.
What I'm curious about a little bit is you mentioned this before, is you were recommending this, educating on it, and then you hit a point where you're like, oh my gosh, maybe it's time for me to try the medicine I've been preaching. And I can't imagine your diet was ever unhealthy, particularly as a dietitian, like quote unquote unhealthy. But can you walk me through that personal shift a little bit?
Yes. So this is 16 years ago when I was 50. And I've been eating in a Mediterranean diet for most of my life up until that point. And a couple things happened. One, I started developing a rash around my ankles and my knees. And I go in for annual mole checkup. So I showed my dermatologist. He goes, looks like a diabetic rash, but you're not diabetic. So just don't worry about it. All right. A few months later, I'm eating dried mangoes while I'm sitting at my desk. And I have these massive hot flashes. And I realize, oh my God, this is the only thing I've changed. What's going on with me? And then I received a shipment in the mail of some, this new, it was a prototype for exhaling ketones, for breath analytical of ketones. So I get myself into ketosis to test these meters. It's a breath meter, and fill out their report and send it back. And I go out of ketosis. And I realized while I was in ketosis for those 3 days, I had no hot flashes. And so I get a new shipment a month later. I have to put myself into ketosis, and same thing happens. I had been having hot flashes, but I kind of I'm not so sure. Maybe it was coincidence. Second time, I have to put myself into ketosis to measure the ketones through my breath. Oh my gosh, no hot flashes. So then I'm like, this is my wake-up call. I need to start checking my morning glucose. So started checking my morning glucose when I went out of ketosis this time, and I'm running 130, 125, 140. And now I'm realizing, how long has this been going on? I feel like I've had these symptoms of something was off for a couple of years. And and then I decided to make an appointment with myself, get myself on keto, and all of those symptoms went away. And it wasn't just hot flashes. I was having gut issues. I was falling asleep after lunch. All this, the brain fog that everybody talks about, that all went away. I also had some bloating and weight gain and acne and all the stuff that women can have when they're going through this change. It all went away. So I really nipped this in the bud. The diabetic rash that I had disappeared. And my dermatologist moved on and I had a new one, but I wanted to go back and say, next time you see a diabetic rash, you need to tell that person, go get checked for diabetes, because I was developing diabetes.
Did they ever check your insulin levels or A1C? I'm just curious.
No, not at that point.
Yeah,
but after funny. I decided I'm checking my own glucose because my doctor wasn't concerned about me. Your weight's fine, don't worry about it. So I did go back in and have, but I was already doing keto, so it wasn't that abnormal. And my glucose was fine. They didn't do a home RA. They were kind of brushing me off too. So basically,
yeah, I'll tell you what's interesting about that. And this is something, Troy, I think is education for us. Cause when I started looking at the gut microbiome going on, I had to really look at it because Troy was like, what are you doing? This is crazy. But the more I was seeing, I go, how can this be? Why is it that when women go through menopause, they start gaining weight, they're hungry all the time, agitated, upset? Is it just the hormones? What else? And I've seen women go on hormones, progesterone in particular. Night cravings go away, their mood's better, they're more even, everything starts getting better on the hormones. I'm like, wasn't, but progesterone seems to be very calming somehow. Well, interesting, when you look at the gut microbiome data, that when progesterone increases the amount of butyrate in the gut, which heals the gut lining, and then the higher your butyrate, and if you're in ketosis, it helps heal the gut lining. So you look at all these things, you go, wow, maybe being on a ketogenic diet is, and that's going to help with the insulin resistance problem. But the thing that's been fascinating, I'm actually talking with some carnivores on Monday about it, is I was seeing carnivores that were super insulin resistant. I go, how can you eat zero carbs and be insulin resistant? They all had leaky gut when I looked. But the leaky gut by itself causes insulin resistance. So it's one of those things when you go through menopause, you may be getting leaky gut. You may be having this constellation of things that we can fix through diet, exercise, stress control, sleep, and get you back on track so you don't have to suffer for 10 years with hot flashes.
Yeah, I mean, definitely my gut was messed up. I'm sure I had leaky gut.
That's interesting.
My stomach hurt every time I ate, and that's all gone. That went away. I did quite a bit of fasting, which I think really sped up my healing in my gut. I would do, 3-4 days of fasting, and I felt so much better after that. But yeah, I mean, I've not needed estrogen. My weight is great. I do exercise. I do hot yoga 3 times a week. I'm, pretty active biking, and but I have no other health issues, none whatsoever.
I think it's just important to note that this, it's a historic time for, I think, the population of perimenopause and postmenopausal women. It's the first time in my career that I've seen, the public health authorities say, oops, we got it wrong. And that happened last week with, saying that, hey, we got hormonal therapy wrong. So, I was just mentioning how you were talking about progesterone, its effects on the microbiome. It's also so vital for sleep, and what an exciting time for perimenopausal and postmenopausal women, to finally get the care that they need. And it was nice to see Marty Macker even mention testosterone for women, which is like something that's never talked about. Getting just a little bit of testosterone, I think, can do wonders. So anyway, just wanted to mention those things.
So Beth, how is your diet now? Like, do you go on a lower fat ketogenic diet? Are you shooting for ketones? What are you doing now for yourself personally as a menopausal female?
Yeah, so I think I run about 30 grams of carb a day, and I'll go through 50 grams of fat easily. Which is about a half a stick of butter, but I do a combination of butter, coconut oil. I have bacon fat and beef fat that I use too for cooking. So I like doing like a half saturated, half monounsaturated, that mimics human body fat. There's a theory from Jeff Volek, who you both probably know, that, that seems to be a good guide. And I've been doing that with patients for many, many years, and never had anybody with major issues with their lipids. some that we've actually explored a little bit because they were concerning, but the lean mass hyper responder kind of a situation where they're perfectly fine. It's just the LDL is high. So yeah, I used to be, and this is very typical in women, big on poultry and fish, and not so much on the beef and pork. And I've changed that with keto. I have, increased the beef quite a bit in my diet because it is so nutritious. The iron content for women is wonderful. It's like the best absorbable type of iron. I've also brought liver back into my diet, and I grew up eating liver regularly, both chicken liver and beef liver, which you can find. Years ago, you could find in the grocery stores. Now you can't. You have to go to a butcher, right? A special butcher in my area, anyways. But I've got a great butcher in the village that I live in who can find it frozen beef liver, chicken liver, and so like the most nutritious animal protein you could eat are organ meats, right? So I've brought those back into my diet, and I've tried to educate other people about how healthy those are to include in your diet. And they're actually a little sweet, right? Because of the glycogen in liver. So, they're different tasting than the rest of the animal because of that. So yeah, I've changed quite a bit. My husband, who wasn't on board with me for many years, as he's gotten older, he's a little bit older than me, he's changed, and we kind of agreed to not talk about our diets, or we talk about our diets, but we don't we don't judge each other. That's what we agreed to, not judge each other. And over time I see him trying really hard to cut back on his carbs, but because he's had some health issues too that I think were entirely preventable through diet.
You know what? We should talk about this just for a minute. I know we're coming on the hour, but I've noticed whenever there's a sensitivity to food, and I'm just somebody who's been 350 pounds, it's always a bit of denial, right? It's always a bit of denial, right? There's no need to be sensitive. If somebody comes up to you and says, hey, somebody's robbing money from your bank account, or hey, somebody is, stabbing your tire, your tire's flat. Nobody ever says, well, don't judge my car, right? Yeah. Nobody says, don't judge my bank account. Like you just be grateful. You just be like, well, gosh, so thank you for looking out for me, right? And when the response is not, gosh, thank you for looking out for me, it's a clear sign of serious denial of how strong this substance is and how much it's captivated the person who's dealing with it, and how lifelong, sort of a poor relationship to it may be at play. So I don't know your husband, never met him. But the way you're dancing around that talk, which that conversation, which is exactly the way everybody who has somebody that they care about who struggles with food talks. I mean, it makes me wish I can help, makes me wish I can help. Brian, how many times have you heard that? Like, I can't talk about this with my wife.
Well,
I can't talk about this with my husband.
Just last night, that happened because one of my guys, he's new to me, and it's like he likes to drink his bourbon, he likes his sweets and all that, and we got into this conversation, and he's my patient now, and his wife is all up. She goes, "You need to tell him this, you need to tell him that." I was like, you know what? It's going to be on his time, and once we get his labs back, I'll be able to convince him, because I know he's going to have high insulin. He has that perfect body type that, you have skinny arms and legs and a big belly that's out. You go, that's visceral fat. That's not going to be a good metabolic markers for sure. And so I go, let's wait, just be patient with him, and we'll get the numbers, and then he'll have to make his own choice, right? At some point you go, look, if you're drinking bourbon every night, you're going to have fatty liver and insulin resistance and all these things. Here's what's coming. So, there's your choice. And, I think that's one thing I believe in, individual freedom. And that's why I tell my patients, like, hey, when you go to Thanksgiving, don't criticize if people are eating carbs and you do, don't say, oh my gosh, you don't have any carbs. You don't, just keep it quiet, right? You can think what you want in your head, and if they want your advice, then they'll ask you. But it's hard, and it's hard, but it's also equally as hard. A lot of my low carb people are going to go and they're like, why aren't you eating potatoes? Why aren't you eating stuffing? Why aren't you doing this? Why aren't you? So it's like this peer pressure, like just eat what you want, let other people do their thing, And if it becomes a bone of contention in the marriage, then that's kind of that can be a stressor too. So you kind of go, okay, like, what do you do if someone believes strongly in vegan and someone believes strongly in carnivore? They both can pull up studies to support what they're doing. And, it's really like, how are you doing physically? How are you feeling, basically, and what works for you. But you're right, Tro, it is a hard subject. And it really does have to do with the tone too. If you go, look, I'm concerned your sugars are high. I'm watching you shoot insulin 5 times a day. Maybe we can make a change. As a matter of fact, just the other night, I was out with my wife and we were it was kind of like a fundraiser. They were doing some music and stuff. And the lady that was like 3 seats from me, I hear that sound of low sugar on her CGM. So what does she do? Her sugar's tanked. She probably had a lot of carbs at dinner. Then she's looking through her purse, pulling out a bunch of candy and chocolate. And I told my wife, watch, in about 20, 25 minutes, it'll go off. 23 minutes later, her alarm's going low sugar again, right? Because her body's reacting. So it's crazy going bad. If she would have just eaten something low carb with some protein in it, she'd been fine. So you want to help those people and tell them, this is why it's happening. And Tro, as a matter of fact, I'll just give you a quick shout out. Young female came in, a lot of anxiety, panic attacks, that kind of stuff. We put a CGM on her and she was getting hypoglycemic like 18 times a day. We got her on a CGM because my friend Tro did this before. So I said, let's see what happens if you stop eating sugar. And she had 0 hypoglycemia. Yeah. For the first 2 days, I said, eat your regular diet. We saw how many times she got hypoglycemic. On a low carb diet, 0 hypoglycemia. It was reactive. And so once she understood it, now her sugars are perfect and she's not having anxiety. She's feeling better, sleeping better. And so these are things that you two have been doing that the rest of us can benefit from and say, let's see what happens, right? Because it's that idea that, well, if my sugars go low, I need more sugar, but it's not the case.
Yeah. In fact, I'm old enough as a dietitian to remember using a high-fat diet for diabetics. I worked at a VA. My first job out of college was at a VA in the nutrition clinic. And we were teaching them to have fat with each meal, low carb, no sweets, minimize sweets. And then one day my boss brought me a stack of new education booklets and it was high carb because we thought we were killing them with heart disease. So high carb, canola oil, completely different. And that's when the epidemic of diabetes began, right?
It's wild. It's well, Tro, I'm gonna ask for your help, Tro, on this one. I think your mic's okay now.
Let's see.
I'm still intrigued by that study you talked about. I went and looked it up. The study where they were looking at fatty liver disease, which is a precursor to diabetes, right? So we like to treat fatty liver disease, and so they put either people on a low-fat diet, low-fat ketogenic diet, or a high-fat ketogenic diet. The worst was the high carbohydrate diet, the low fat diet, but the best was the high fat ketogenic diet. I'm like, why is that? Why would adding more fat in, Tro? I don't know. I just don't know. I'm trying to think why that would be. That I would think a lower fat ketogenic diet would be better for fatty liver disease. Do you have any ideas, Tro, or do they explain that?
I gotta.
Or is it just what it is?
I guess it's a lack of fructose and replenishing sort of carnitine and certain basic nutrients, right? So like but I don't know. I got to go back. Maybe not carnitine. Maybe I'm blanking on that one right now.
Well, anyways, I would think that would be the best.
Maybe Beth can help us with that. Why?
Yeah, Beth, me and I know.
This was like 6 months ago or a year, within the year, certainly.
Yeah, well, just related, I don't know the answer to that, but related to that, there's a study on GERD, how, people are like, I can't eat a ketogenic diet because I've got GERD, and GERD would irritate this. And there was a study showing that the high carb diet makes GERD worse and a ketogenic diet improved it. And that's exactly what I saw in all of the people that I've worked with, because lots of people are on drugs that cause GERD, and you go keto and they have no problems, partially because the volume of the meals are much smaller, right? You take out the pasta and the potatoes and the high volume carb rich foods, and there's less volume on the plate.
It was choline. Sorry, I had to look it up.
Choline.
It was
Oh, yeah.
choline. I'm like, I said carnitine. It started with a C. It was choline, and probably vitamin D deficiency. So.
Oh yeah, that's true too.
That's what I'm guessing.
That's very interesting. So all these things are so interesting. So I just love what you're doing and how many people helped over 30 years. And again, it's like, how patient do we have to be? How patient do we have to be when something works? And Beth and I are on the same page, because everyone's, as a matter of fact, we just had this discussion. We had our Zoom meeting with all my patients last night, and they're like, what do you think? Are you excited about the new guidelines? I'm like, really, I'm not. I don't think anything's going to change. And if they do, it's going to be a micro step in one direction. But you can't really have a guideline for the general population. Like, we're all different. So some people need more carbs, some people need less carbs, some people maybe have seizure disorder. And the craziest thing, and this is what I was explaining to him, Gary Fettke's trial, the whole thing was a joke because the food pyramid was never designed to treat any illness, and 93% of us are metabolically sick. So right. So in effect, it's like that only applies to 7% of people who are very healthy. And you go, okay, you could probably eat that and you're fine for a while until you get to where we need to, until we get to 99% of people are messed up.
So I think what they're doing, because I've talked to Jeff Volek. Jeff Volek was in charge of the carbohydrate section of the new dietary guidelines. And, he's got vast research in diabetes and metabolic conditions.
Oh, yeah.
Using low carb and keto diets. So what he suggested is that they include like a clause about, because so many Americans are metabolically unhealthy, a lower carb intake is important, something like that, like to separate the class of Americans from metabolically healthy to those that are at risk for metabolic health, yada, yada. So he's given them all that information, and, if they, who knows what's going to end up in the final recommendation.
Yeah, I'm like Brian. I'm not holding my breath. I'm hopeful.
Yeah, we have Nina Teicholz. We have so many good people up there, but there's so many vested interests. But the reality is, this podcast will reach a lot of people, and there's people who are going to say, look, here's what I'm doing and it's working. I feel better, like you saying my menopausal stuff all got better. Seizures go away. Like, if someone hears seizure go away and you have seizures, you're like, what did you do? Tell me what to do.
Well, what about brain tumors? I've worked with people whose brain tumors have shrunk completely. They're not even identifiable on an MRI scan. That is incredible stuff. And it's incredible. Matthew Phillips' work, he's doing stuff with brain tumors and ALS and you go, my gosh. So when you start seeing it for all these different conditions getting better, you think, how can you not look at that? And I was going to ask you, and I don't know if you know or if you've seen anything, do we have any data on people who've been on a for seizure disorder, long-term high fat ketogenic diet? Yeah. And are they at increased risk of coronary disease? Has anyone ever, it's always been the concern, but has anyone ever looked at that? I don't think anyone's published it. I certainly have patients that have feeding tubes that are never going to be able to eat orally and have been on keto because they have a genetic metabolic syndrome that predisposes them to seizures. And there's a whole bunch of them, like Angelman syndrome. Dravet syndrome. All these rare genetic metabolic disorders that require that benefit from low carb and keto diets. So you're afraid to take them off. But we've, in the people that I follow, we've sent them in for an NMR every year and chemistries. They're perfectly normal. There is no issue.
Isn't that amazing?
But we're feeding them, good fats. We're not feeding them oxidizable fats, polyunsaturated fats. So when you're saying good fats for people listening, what would you say? Okay, if you're going to add this kind of fat to your diet, what would you recommend to people? Yeah, you want to add real fats. So of the animal fats, butter is the most widely available animal fat that you can get. And a step up from butter is like a European butter that comes from cows that are fed grass, and there's a little bit of probiotic in them. So that's the benefit of paying a little extra for those types of fats. There's vitamin K in that too, which you don't get in processed butter. But you can buy in a jar in stores or get it from a butcher for some of you, beef fat and chicken fat. And I think olive oils, are especially extra virgin, which has more polyphenols, those are good too. I would watch out for avocado oils. Some of them are processed with hexanes. You want to get cold pressed, just like extra virgin olive oil, which is a cold press process. So we have plenty of fats available to us.
Oh, are you okay with coconut oil too if it's cold pressed?
Yes, coconut oil is great, and I use it myself. Some people like the MCT oil because you get more ketones. It's just, it's the fats have been sorted from coconut oil to give you the shorter chains, which you absorb quicker and you make ketones quicker, more expensive. But yes, of course.
Awesome. This is even better than I thought it was going to be, Tro. That's amazing.
When we bring people smarter than us, we always learn.
Yeah, it's great. It's great information. And if people want to track you down, do you have a social media presence, things where people can find you and follow you?
My website is just my big old long name, Beth Zupec-Kania. And I'm on Instagram. I don't do a lot of social media because I have a lot more work than I can handle. In fact, I refer a lot of people over to Denise Potter, who has a dozen trained keto dietitians who, work with people of a variety of disorders. So
she's also a beast. She's also amazing. Yeah.
I filter a lot of people. Yeah, you should talk to Denise as well. And she and I team up to do this virtual keto mastery course for dietitians. So dietitians can get credits through taking our course. It's just ketomastery.pro. And we have other people that take it. We have even some patients that will take it. We're fine with that they want to get educated. So we have a foundational course, we have an advanced course, and we have a psychiatric course.
I could use all of those. I could use all those courses.
Yeah, we need all that. How about Charlie Foundation? What's the best way for people who have kids with seizure disorder
looking to make
themselves?
a donation, guys, what a great organization to make a donation to.
CharlieFoundation.org started 32 years ago when young Charlie started having seizures, and they tried all the available meds. He still had tons of seizures, sometimes 100 seizures a day. And his dad, who happened to be a Hollywood movie writer, found out about keto and took him to Johns Hopkins. He started the diet, seizures stopped. They weaned him off of all three anti-seizure meds, which were probably causing some of his seizures. And he was on the diet for about 5 years. He's 33, hasn't had a seizure. He lives on his own. He got a degree in early childhood education, and he's a preschool teacher. So he's done very, very well. And the family has kept the foundation going because they want to, pay it forward to other families. And they actually expanded outside of epilepsy. So now the name of the foundation is the Charlie Foundation for Ketogenic Therapies. For whatever application, that there is medical evidence of benefit, they provide resources too.
Well, I'll say, Tro, if you can if I was a preschool teacher or a kindergarten preschool teacher, I'd be like having seizures. So that's a good stress test of see if it worked. So if you could do that, that's pretty amazing. That's what my daughter does. So it's a challenging job.
And he's over 6 feet tall. So I'm saying that because one of the complaints about keto is that kids didn't grow on keto. He's taller than his brother, sister, mom, and dad.
Wow.
Yeah. Look, we got to break a lot of these fallacies. Beth, thank you so much for coming on. Thank you so much for, sharing all your insight and wisdom. And I hope there's a dietitian out there who listens to this course, and maybe we can get you at the SMHP to talk at Boca or at another event at San Diego to talk to dietitians and be a mentor to dietitians. And hopefully you can bring some of our people from the SMHP, our doctors, over to lecture with you at these hospitals and institutions. We have doctors all across the country who are ready, eager, and waiting to, give grand rounds and talk at these institutions. That they need our help. They certainly need our help. And I just want to thank you, and I appreciate you taking out the time today and joining us. And Brian, it's always a pleasure also with you. And we'll put all of your information in the show notes, so it'll all be there. So thanks again.
Yeah, thank you, Beth. Appreciate it.
And thanks to all the listeners and watchers who are watching us now and our supporters. Thanks for supporting this podcast for now, Brian, 7 years officially.
If we make more money, we can get Troy a new mic or something.
I just got a new mic. Oh my God, I just got to fix it.
I just have this old one. It always works. So I'm like, I'm not messing with it. I'm sticking with the old
This
thing.
is like my fourth mic. All right.
All right. Thanks, everyone. Thanks for listening. Thanks for your continued support.
Thank you. Bye.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.